the best practices of top-rated plans really start with developing a STAR strategy, execute on that strategy, and then also refine that strategy. So the top 3 best practices, one would really be understanding a targeted approach for that beneficiary, understanding how the member really needs to make those healthy decisions. So some examples of that would really include a health plan predicting non-adherence, and really predicting that non-adherence by identifying those beneficiaries that could be in need of an intervention, or also providing incentives for those members to really provide them either gift cards or incentives to take some of those test screenings and tests to help make better decisions ultimately in deciding their preventative health. Secondly, knowing your data, and health plans that really perform well know their data inside and out, and they use that data to optimize those touch points overall, and then ultimately achieving those STAR goals, and also provide greatest level of care coordination knowing that integrated data. And third, which is probably the most important, is that focus on the member experience, and that member experience is absolutely crucial in achieving member stickiness and that retention that health plans are really looking for. So some ways to really focus on that member experience and achieve that retention is really utilizing the power of social media, understanding how those members make decisions, and also engaging them through multiple channels, not just the member, but also the caregiver, which really makes a huge difference in achieving your STAR goals. Benefits of member engagement are absolutely critical in achieving that virtuous cycle of having that full member engagement and participation in your overall plan. So plans that successfully engage their members on a regular basis achieve that member stickiness that so many plans really shoot for, which ultimately leads to a member who's utilizing their benefit, they're achieving those health outcomes that the plans are looking for, and driving towards that ultimate member engagement. And hopefully those members are sharing their good experiences with their peers in the community, share those good experiences, and then also stay with the plan for years to come. On the flip side, plan sponsors that do not engage their members ultimately end up with members who are disconnected from the plan, disconnected from utilizing their benefits, and ultimately may really leave the health plan and potentially even share poor experiences with other peers in the community. Data plays a critical role in helping plans achieve a successful STAR strategy. It is really important for health plans to understand their data inside and out. It could be plan-specific data, member survey data, industry data to help them identify the areas that they're not performing well in, and really chart their strategy of how they're going to turn those areas around and perform better. Secondly, plans can't just focus on current data and their current experiences at that point in time. You have to look at your historical performance and understanding how you performed a couple years ago to where you are today, and then most importantly, using those data points and charting your future year strategy, next year, the following year, to really understand how you're going to achieve those STAR goals that you're looking forward to. But thirdly, and most importantly, is really engaging your organization, and that really can just be done with one department within a health plan, managing your overall data and your strategy. It's achieving that company-wide mission, that organizational alignment, and using that data to help the plans chart the strategy, help the organization understand where they stand currently and how they're going to achieve those goals collectively as an organization.